they don't get hepatitis B, hepatitis C. We also do blood work for them. Then weight-wise, also they need to be thin. Then BMI for the about 25, not more than 25, for low able to take them.
So when they pay them, if anybody they watch right now, say
one for me. So we let them pay, we they compensate. We let them pay, we just for say thank you for the service. We they give them small thing, yes.
Because I feel say if there is an amount to that we don't put, for people they come and donate, I feel say we don't get plenty.
We now we don't they out there. So before we do get people out in the camp. We get ready for the next batch, and I think say this batch we get about 12 donors because the word don't begin go out there now. And yesterday I believe we get a lot of people who then call for inquire about the donor part.
Is there any way when they make an official, because we know sometimes the people can then at certain time, so all just go give, but later in future it go perhaps regret and say la go in the back. When I get documents like people they sign say yes, they don't come donate.
Yes. So before they even donate, they put them through counseling first. One, where they can donate to with anonymous, meaning they don't know that they donate for, not through within the door of that day, and they don't know that they use the egg for. And if the couple want for no, then they know, but not so much as personal details of the donor either, but they know in medical aspect. And then the donor in they don't without they use the eggs then for. And we also get a consent where they sign for say if any picking come up from this, you the donor not responsible for this picking, and also you need to come back and say this is not me picking I wanna give me.
So still on the issue of the IVF method, we know some workplace and they now we get medical insurance for the staff then. This particular method, medical insurance able for cover the procedure?
I don't think so. Currently we work on trying for be within the insurance network. But even if they not cover the IVF part itself, but then we for cover a lot of the testing and a lot of the medications and other things then. So we work on that process right now for get within the insurance network.
Apart from this successful case we don't get, in terms of success rates, how many people we don't go before now from their number then they one able for be successful?
So the success rate we can base on the age group. Because the younger the person, the woman be, and the much better they are for be pregnant. We get this one now. We get other one where they deliver this upcoming week, and with this same batch of these people who then deliver, we get maybe 5 of them be pregnant. Unfortunately, the 3 end up in miscarriage, but then 2 they also don't go full time now, and then we get other one that we then due in July, August. For deliver.
So the successful case now, what's in an age range?
They under 35.
What are you going to say the best candidates for going for IVF?
So I will say somebody younger, but I don't want to base the candidate aspect. If there is someone healthy, even if she's healthy in her 50s, and it opt for use donor eggs, it gets still a chance of being pregnant. Considering if everything else being equal, meaning the womb okay and the hormones are okay, it still stand a chance of being pregnant. Whilst you can also get somebody within the 20s because of other medical conditions might not be a candidate. So I don't want to say not only people in the 30s go be pregnant. No. The one main factor will be the egg and the sperm. If they are younger ones, the embryo good and the host also good, then stand a chance of being pregnant. And for somebody where maybe young but womb not good or it can't be that receptive, we can say opting for use a surrogate, meaning somebody carry the picking fauna, So then they also not an option for make the people and get them picking.
For introduce short method now Sierra Leone specifically, if you say in future, we get psychological effect with regards to them picking their way with the get through the IVF.
In terms of,
I don't know the kind of how best one are able for get the information for keep and secrets between the donors and the one that we get for come and get them picking them day. But however, we know that in the African setting, however it take long, people get for nurses, then the picking go through the IVF. So we look at some of the psychological effects of that particular picking day.
Well, when it comes to even, we can advise the woman when they use donor. eggs that as a starting point, because we can't tell exactly how many donors then egg will go to the patient. And we keep the record. We get the record for say patient A use donor 2 in egg for let it happen. Then we can keep track on that aspect then. But in terms of the psychological part, IVF don't happen at the world. The oldest speaking now about 46 since 1978. You know, so it don't they around for a long time. It just depends on the couple on waiting they want them picking for no. Wait as they picking the grow up. And if they want for say we conceive you through IVF, you know, that's not their own decision. In terms of your own part, that recorded for say donor 2 in egg will be used for you, not they go out. Now we the keep them. When you want that information, you can cancel. We will tell you that egg will use for you, which you cannot from the beginning anyway.
In terms of the treatment for infertility, the man and the woman at the same time frame on they use for treat them?
No, for man they take much longer, because if you consider say man they get sperm every 72 to 90 days. So when we get for wait almost to 90 days before we say we retest, depend on what we retest for. If not because the man not produce that many sperm, or he produce sperm but in sperm we say get a lot of white blood cells where they show say get infection, then after the treatment we can say wait 2 months, you come back we retest and see if that infection they don't clear. And then if you then they go help you not only the count but also the motility of the sperm.
For the one them way in case they not can be successful, where una can notice say this one not going to go through. If una they go back on the drawing board, the procedure they change or are the same because na IVF na the same procedure na they repeat? So
it depends waiting to be the reason why it fail. If this woman just get a clear scenario, so maybe this woman they 35, then the AMH level low from the get-go. Then we don't see say, well, at this time you may say we use your egg, but we don't say don't take away, it not work. Now we'll get to the point we'll come in with a much younger egg. So yes, we'll go change the plan. If we don't try your method of say use your egg at that time where we not say there is a slimmer chance it will work, then we'll go use a donor egg. So we can change the plan. Then even maybe if say the medication we use for stimulation at the first place, maybe you won't stop at stimulation phase, then we can change that one day and come up with a different medication we'll go give you.
Earlier on you talk about family planning as now once you really disturb woman they not for being fertile a lot. So how this very difficult for women then, because plenty of time we don't see women then they take them preventive measures and they where at times when they go to hospital they will tell them that because you don't go into this family planning for a very long time, don't affect you.
So the thing where the medications then can do in terms of the purpose of taking this family planning for basically allow the ovaries woman not produce egg. So the longer you take them, the more it affects you in terms of say they really make you ovaries for stop for function. Okay. You know.
So waiting at some of the treatment there because they get different kind of contraceptives that we need to use for prevent them not get better. So whenever they want for born picking out, so waiting at some of the process that we need to go through.
So then get for stay off the family planning first. Well, at least for a year. Stay off completely, not take any medicine, and let we see if your ovaries then go start for wake up on their own back before we even say come in for treatment.
You know, if you say going through short method can disturb the ovary?
Going through family planning?
Planning, yeah.
Well, disturb the ovary in the sense of say they kind of make a dominant in any work at that point, which is not the purpose of family planning anyway. But prolonged family planning can result into that because they make the ovaries really quiet for too long.
How safe the egg retrieval be for IVF, taking into consideration for the ovaries not going to be damaged?
So the egg retrieval we do one through an ultrasound, a guided probe where they see as the probe they go within the woman in I will call reproductive cavity wise. It's guided. The needle is being guided. It's a small needle, and we see them through the ultrasound before we harvest.
So the cases them way una don't get so far in terms of confidence level, how you could describe the patients them we don't go through a facility?
I think so. We patient them basically confident in the sense we be open with them and transparent as possible. We cannot advise ahead of time for say if we go this way we want to go, it's very slim that it go work. But you think that you want because we get for listen to what the patient want also. But since that this one, we can try your method. And then if you not work, we get for come back and Lord do on we own way, how we want for go. You know. But then also once a patient go home, we don't know how what to do now. We go advice. Because I'm even one of the case when we get now the husband they call me say, look, the patient there, so they open gate, they do water. So we, even though they tell us, you know, for do all of them things there, so some patient don't use for do them. And it had for we, you know, for stop them.
Yeah, and that it take me to the really strict restrictions then where somebody they go through this procedure, the IVF. What's not the restrictions they want to give the person where for stick by them, not even depending on the medication, but then restriction and then you must stick to them. So
once we don't do the embryo transfer, I can tell the patient and say take her easy. Even the husband, I can talk to them and say, if now this woman is responsible, because you know, say what's her business and issue now, if now this woman is responsible, like even for the cook, for the brook, for these next 2 weeks while to wait for the results, for get a better chance of success, get somebody else for help and for do that stuff than they. Enough for do too much, for claim up the step them too much. Enough for lift anything weighing more than 10 pounds. 10 pounds is about 4 point something kilogram or less than that. You know, so a very, very limited weight for that woman for lift. Then I can also try to talk to the woman then for find out which kind of job you do. If your job require you for the work out too much, I will say take off for these next 2 weeks just for give yourself a better chance of success.
For each of the method, if one don't fail, how long it will take again for try back?
So it depends when the method fail. If the procedure fail at the starting of stimulation, we can say wait, let you get 1 month of your period, then you can come back the following month, we start again. If we go all the way to the 2 weeks wait after transfer, then we can tell you say wait at least to another 2 cycles of your period. So once the procedure fail, in any time of the whole thing, you get for bleed. And when you bleed, with the weight, then adjust because your body will go through the withdrawal of the medications. We say wait. When you start your period, wait for another 2 months. Then you can start. If not, towards the end of the procedure itself, then they happen. We'll say wait for at least 2 months. We'll come back.
The medication they use for the IVF, now one way, just stick to waiting when they give the person, or if, for example, you run out of supply, you can go and get them for himself na any pharmacy or stuff, or now waiting on the game, now the clinic for refer to back.
Yes. So when it comes to the stimulation, now waiting you they buy from me because these medicines they're supposed to be kept in a cold chain, meaning they for always they cold. So if you go buy them outside, we don't know how to store them. And if the medicine not keep in a cold chain, also can affect the result what we get. So now make okay advice say buy them from we because of the chances there.
But is it affordable?
The medicines, yes.
Because like you say, we all know plenty women and couple and the way they go through this, but because this nothing we seen at this part of the world, go remember the cost involved. We can make some man go say la go the traditional way if unable to do the English way.
Well, I think say most of them already they try the traditional way and it don't work. So most of the time, the people that they can't, so we already don't try for years. Not to people that just don't say, oh, now 6 months ago I don't try for get pick, you know. These are the people that already don't try a lot of other ways and it don't work.
Can the two go together? Maybe they try the English way, say they try this la to papa. So it go happen. Anyway.
My advice goes be no, because some of the herbal medicines that we take they also affect the English medicine we give. So I go say no. So even when we do the first consultation, a part of the things I know they tell you. So whatever else you use, you need for stop. Then any other medicines where you take, where even an English medicine, make law we know. Because some of the medicine the way you take also will affect what we want for let happen.
But now go able for detect if somebody they take other medication for the same purpose. Because someone just because of desperation, he wants for let it work. He not gonna be honest with you for tell you say I be done there on other medication or I be they take this for this same purpose. Unable for detect that?
No. So we depend on you the patient for be honest with me. Because we all work towards the same goal. If now picking you want and we there for help you, I think say the best you can do now for be honest with we say they take this medicine and this they take now, then we can advise if not, and sometimes it can even be saying that maybe not something we can even use in the process. You know, but if you be honest with me, then we can know say okay fine, this is not to the right time for you for come in because you get still this drug inside your body. Low wait, then so time you come, low start.
Alright, today about we can look at the story of this one first successful case. But before we can get the clip for going to the clinic, Usai we report a go, just take me through this particular successful case. Okay. When una being first meet with the woman, when he come in consultation, and how long it take him for go through all of this.
Okay, so we meet with Mrs. Kamara. I believe saying back in January, February of 2023. So it come, we do this. This was after we don't get a failed IVF procedure in Ghana. And we actually did get pregnant, and then it resulted in miscarriage. So it come, we do the screening back in, I believe it was February. We do the procedure, of course, it was unsuccessful back in April. So we wait, it come back, we do them again in July. So in July, we start on contraceptive, we start on birth control. And the purpose of the birth control now, basically, for how we get the woman, who's how we want them for the, in that time, say, we want them for bleed, because everybody get different time within the seeding period. So for how we able to put everybody on that same group, because the specialists are not in also, when we know sit in the camp, we put everybody on birth control for at least for anywhere between 14 days to 30 days. And then when we stop the birth control, few days after that, then they start for bleed. So when it start the bleeding, then we start for getting the injections for stimulator. We do Mrs. Kamara immune retrieval actually on August 6th. Now do
last year.
Yes, last year. Now been the first retrieval actually for that batch.
Okay.
So we do a retrieval August 6th. Then we normally get too many eggs. When we put them together with the sperm, we end up with limited embryos. So we opt in for do a day 2 transfer. You know, usually they can advise say day 5, but if we get less egg and less embryos, then the best side for let the embryo inside the human body anyway. So we decided we transfer them on day 2. The day 2 was on August 8th. You know, and then now we deliver.
Admission, then can they or I can do the procedure and the person go back now?
So once they will do the retrieval, after the anesthesia don't left them, then they go home. Then when they come for the transfer, they need to sleep, meaning they need to awake. The transfer is less about maybe like 10-20 minutes procedure. Then they come, then they awake, we transfer the embryo inside them, then stay about 45 minutes to an hour, and then discharge and go home. We give them, tell them what they take, the medication what they take for support them through that time day, and then go home.
If somebody is so they in desperation, he get fear say, la no gonna host and perhaps go do waiting all right on our facility, they able for host?
Yes, so they're able for keep them for be admitted, which actually now we try for encourage, for let them stay at least even if not for 1 week, for give them a better chance of implantation.
The notion of these people in Africa, like Sierra Leone to be precise, now God they give Peking. In most cases, you don't see women, they don't try different type of hospitals in the traditional way and also in the English way, but not able to get Peking. After they don't can sit down for a long time, we see them able to conceive. So I want you just look at these aspects, say now God they give Peking, whether you go just sit down and say now God they give me Peking and not go through the right medical attention we're supposed to get.
So even with the IVF, we still believe in God they give Peking. Because once we don't go through that procedure, we don't transfer that embryo inside you, we don't get control of what's in that inside your body. So at the end, still they still look at and say that God they give Peking, you know, and I make the whole IVF is called assisted. So we just assist and we hope for better. But most of the women and they for say they don't go through all of this thing and then end up forget belly. Maybe waiting me wrong with all this treatment end up for be corrected without them even noticing. Maybe they may get hormonal imbalance because doctor put them on this and this. It did not happen immediately at that time, but eventually their body end up for kicking and begin work on their own. You know, then they end up for be pregnant.
Alright, well, you where they watch, continue for drop your comments at the comment section. Ask any question where you want for know about IVF because we get Justina Jallo Jamborian at the studio this morning. They tell we all things where you need for know about IVF as they don't get some first successful case where somebody go through this method and able to get in your Peking. Well, in case you get any question for ask or comments for make, drop on the comment section at the different platform them also they get with this morning. As we they talk to the CEO for Sierra Hope Facility Clinic. Now at time for let we go and watch waiting with reporter Mohammed Kamara bin Brinkam. Usai then we get them first successful case and then we get media people and they for cover this particular story. Let we see waiting Mohammed Kamara Brinkam from the clinic.
For Seka, the challenge, we plenty women them, they go through na saloon, forget belly and born pikin. We make them refer to them as barrel, and people them, we not go able get belly and born pikin. When that make, the Sierra Hope Fertility Clinic don't come for help address born pikin problem, we women them, they go through, and other well body issue them na the country. Justina Jallo Jamboria, na the Chief Executive Officer for Sierra Hope Fertility, first start for talk about the in-vitro fertilization process.
Yeah, so we dey help women then we couple, let's say that when they struggle for born picking, we they assist them through assisted reproductive technology. With the main one, IVF, in-vitro fertilization. So that we do in a nutshell, or basically we they remove the man, get the man in sperm, remove the woman in egg, we put them together outside the body, and we come back and transfer inside the woman. And we do testing after 2 weeks to see if the procedure work. So today na a good day for we, because today we first speaking, we conceive through IVF na salon, na today e born.
For know how they can go about the IVF process, Justina Jamboya explain more.
It all depends on individual basis. Some people can come after the test, everything fine, we can able to move them to the next batch. We go maybe be like a month. Some people will get for take time for treat them first, get them the right place before we decide to go ahead. But from time where they start for giving woman medicine to the time where they do the retrieval can take about 10 to 14 days. And then about 5 days additional follow we transfer the embryo. And then after that, we wait 14 days follow we test for see if the procedure works. You can do IVF as much as you want. This stable because you don't, do one thing enough for do IVF again.
Justina Jalo Jamboya, same way so talk about the challenges within the face for do them work.
There are a lot of challenges because even with medicine, we go for import them. When it comes to even carbon dioxide, we would need for use for the incubator them for fertilize the embryo them. We will use for import them. Then even nitrogen liquid, where we need for freeze the embryos them, we get for import them because they're not in a salon. So the thing follow we for do IVF, we need egg, we need sperm, and we need body for carrying the picking. So the young woman there, we actually need some of the help because we also get older women there when they need produce eggs anymore. So we can also ask for donors from the young woman and they, and then even when it comes to demand their own part back, we can also need help from that part there. Okay. But if we get young woman there right now, we think say no one born picking yet, but they plan for born in the future, they can come and they freeze the eggs now, so that we can keep them for them when they're ready for born. They can just use that egg there and born.
How the in-vitro fertilization don't benefit woman them, we be don't they look for born. One party woman them, we benefit from the IVF, share in experience but the process.
Cancer alone, they can't tell me, but this hospital, where they ready for opening, I can't they get the polo safe. So now me man tell me, but the hospital now, so now I decide say before I go Ghana, I get for pay transport and the feeding, the expenditure is too high. I decide, I wait here. If we don't open an salon, need no day for my go Ghana again. Yeah, they better. But the transport no more for go Ghana. Where the last day where they go Ghana, my man back they go. So my man sometimes my man they go 210. Sometimes the way me they go, I not going for return again. So the transport alone and the cost of living and the side where they go stay back. Yes. So me I prefer I happy. Today I not believe the joy. Today, most of me company they sabi me. Where I go Ghana, I get me document everything. The doctor they sabi me na Ghana. The last hospital where I go na women hospital by airport. Yes, they sabi me. I go to Kubokuti, but me no be they give up. My man they tell me say my patient it go happen one day. I get
the woman we benefit from the IVF end up calling in company woman them we be done the struggle for born picking for Kamna Sierra Hope Fertility. For Liberty Online TV, Mohamed Kamara reports.
Welcome back. That's the reports where Mohamed Kamara pull na the Sierra Hope Fertility clinic. Also, we talk to the first successful case where they don't get from this particular method of IVF na salon. Now the first time this way somebody don't go through this particular method and this clinic make it able to get in Peking. When they come back to the CEO for the clinic, we just don't hear it from the successful case where una don't get this person in question. Na post we don't born before na first time this forget speaking.
Now first time this forget speaking, we don't get belly before. As I think it did state time. So we don't get belly before. Even when we go Ghana and we do IVF there, you get pregnant. Then I believe 2 months or 2.5 months after that, you get end up in miscarriage.
So in your case now, where we use as case study for a successful IVF where they don't perform na Sierra Leone, in your particular treatment, how successful it been sound like? On have been try and fail on a just a one go treatment? For
no, we tried first before, back in April in our work. So he came back in July when we started contraceptive and eventually work for her now.
So how, when it been try and fail and come back, how soon I been get for detect say, oh, this don't work?
With the second time?
Yes.
As soon as the transfer happened, 2 weeks after that, we test for pregnancy, and pregnancy was confirmed.
The issue of smoking, drinking, it getting a side effect on somebody where perhaps want to go through this procedure?
Yes. So for the man then, smoking and drinking not good because it affects the sperm production. You know, and then even for the woman then, definitely smoking not good and drinking not good, even for say natural pregnancy itself, you know.
So the injection itself, the one way to go through this procedure, for example, if somebody they don't want injection, is possible for them to get an option to that?
No, unfortunately.
Oh, right side left so. You don't go light?
Yeah, you don't go light. Oh, it's a. Oh, it's like a bit.
The vision.
Dennis, if you need to camera for which one?
Alright, welcome back. We sorry for that break there due to power cuts. We still there. You dey watch the Liberty Breakfast Show, and at this edition of the Breakfast Show, we theme na health. Also, we dey talk about IVF. They don't get them first successful case na Sierra Leone, where na the Sierra Hope Fertility clinic. They don't get the first successful case where somebody go through the IVF method, and before that break day, we be dey talk to the CEO for the clinic where we dey tell me about the first successful case where them we don't get. And like I asked earlier, if person they with the free injection, any option they to the injection, or you just go for stick to them?
You get for stick to them. There is nothing by mouth yet way possible for let the person use. The only difference that instead of we do like we call intramuscular like IM injection, we go do sub-Q. We not through very small needle. So we get option in terms of that, the bigger needle versus the smaller needle.
When one can do the test for the man and the woman with regards to for let them put you speaking. So also more the problem can be. Now they get more problem from the male or to the female? Well,
all over the world they say now 50-50, but so far in a salon where they find out say it's more on the man challenge than the woman side. I think so. What thing they happened in a salon is that you will get somebody where they're married young, and they try to get picking. Years they go by, then at the end, instead of get to a point to say eggs they need to work that much or they're not good again. So the woman self kind of forbid that. So right now, based on what we see in a salon, there is more issues on the man factor versus the woman factor.
Waiting they lead to that?
For the man factor?
The man, yeah.
So we get some man then maybe they get infection when, because what they know the man factor part now based on the semen analysis, where we talk about the sperm. So if the man maybe his sperm not so good, but this woman not they seek treatment all this time, but the man not ever get tested. So years after years, the man did the test, they know if he okay, and come to find out now, say, okay, fine, this man is sperm not even good. So there is no way go for impregnate this woman. You know, and the reason why it can contribute to that, as I say, it can be different things. It can be due to infection, it can be due to obstruction, meaning the outside the sperm for come out, for can meet the semen, let them mix, there can be blockage, you know, and then sometimes for the man themselves. And to be honest, when we can sit down and talk to couple them, the woman can notice say, the man is sperm not right. When way back then, his sperm seem a little bit thicker compared to how he look now, you know. Then even if you as a man, you find out, say, even your sexual drive not did that much the kind of day before, I will say get tested. That maybe hormonal levels which can a factor for you produce sperm when the testosterone not so good anymore.
Looking at the sexual drive you talk about.
For the mommy and daddy business. You know, because a man, if you're able, you
able to do it effectively.
Effectively. I also get some man the way the urge not even come to them.
Okay.
You know, which is strange that you get a young man, not even get a urge for say last sleep with two man. You know, so that factor they can be also something for look at and say why this they happen, or maybe before, even if it not been way back, say it they happen, but you able for no say the way me company man they talk about the sex drive for me they happen that way they get tested. Not only through the sperm test. When we do the sperm test, then you also get for check you the man you hormone them for see.
What about man the way they use some drugs when they want to do man business? You know, we say that they affects them.
Yes. So first of all, illicit drugs, which Nasalone, one or is Kush, tramadol, all of the things, and they affect man sperm production. Even when it comes to a lot of these other things that we would take, even diabetes, they affect man in sperm production. You know, so if you're not somebody who get hypertension, certain medications, then they are legal medications, but when you take them for hypertension, they also affect you your sperm production. You know, so these are all things that it make when we sit down with the first visit, we look at all of these things and say, which medicine do we take now? Which medicine we don't take before? You know, not everybody can want for say yes, they take tramadol or this and that, but we need for know. You need to be open, and sometimes it's not about say judgment wise, because some things, and they also, for example, paracetamol and Tylenol, which is in the color paracetamol, America they call it Tylenol. Then two things are the same thing, not the same exact ingredient in the medicine. But if you not tell the doctor say are they on paracetamol, the doctor can prescribe Tylenol back for you. Now the same drug you take at the same time will cause more damage for you than good. So that make you need to let the doctor know say, doctor, are they on this medicine? Before you put me on this other one, so we will know how best the doctor can for treat you. And not just mean say for fertility, it can be for anything, for any treatment.
Okay.
Anything the way somebody for do for like increase in chances for being successful where they go through the IVF?
Yes, one thing I could say, listen to the doctor, listen to the medical team, their advice. We all look for the same goal, which is for you for end up with you picking. So I know say like we also get the cultural thinking that if not to me carry this picking, it means not to me picking. I don't want to man for think that way then. If we don't do testing and we don't see say you woman not gonna be a good host for the picking, you can opt in for surrogacy. Let somebody help carry the picking, you know. Then also for let you go get a better chance of success, diet plan, diet control, manage what you eat. You know, as I say, incorporate exercise in there. You know, and then follow when they say take your medicine this time, take your medicine this time. If you miss your medicine, not to think for hide. Make let the doctor know, say, hey doctor, my medicine for take care, I don't take them more, or I take them but I take them late. Or maybe why they give me self the injection and not give me self the injection right. So at least we go know maybe okay, instead of we give this amount today, we will need for increase them. You know, for that time they just for let you go get a boost from what you miss. So be open and trust the doctor their advice.
How do they handle counseling? Because like you said, say stress not for be related way to go through this process, and also like you just mentioned, for let somebody accept say maybe this not come from me self. They need for help with medical and they go through how do they handle the counseling with them?
So from the time where we meet with the patient and from the very go, make and tell the woman them. Because I can look at her and say, yes, most of the patient then don't they try for years. And you work in all these years not changing nothing anyway. So we can begin to talk to them from that point. They say, try for limited stress. Because you know they change. You know go beneficial to you and the procedure at all if you will be so stressful about it. And also it's part of human thing for say we'll go think about something and stress go kick in, but try for limit them as much as possible. Try for manage them. Everybody know what thing that they use for manage stress. You know, some man go say listen to, if they are Christians, listen to gospel music. Some man can say pray more. and try for handle that part of stress wise.
In terms of the cycles, then what are the difference between the short cycle and the long cycle of IVF?
So they are based on the medications the way the doctor they use. And I will determine whether it is short one versus a long cycle. So for patients, then we can don't do the screening, and when we talk about if we can change the plan later. Especially when patient can't wait, then we ask and waiting we don't use before. Can determine say okay if this person don't get the short cycle may just mean say the time very short, and it also mean the drugs that they get at that time. And I can determine the difference.
So like this first successful case where I don't get so, after we don't get in picking so, you get for any medication or it just gone in normal life?
No, it just gone in normal life. Well, past the few medications we put on for this child, which are just normal how they call them, maternity medications, like supplements and stuff like that. So in terms of the IVF side, you don't know that part you don't complete. So after that first I would say 10 weeks of pregnancy, the pregnancy first trimester done, meaning the first 3 months. The pregnancy is just like any other pregnancy. There is nothing different with an IVF pregnancy and a normal pregnancy. That first 3 months, then are just because since we try to alter your body for work how we want it for work, we get for continue for support you on hormonal drugs. But after that first trimester day, we are comfortable with it, then we don't done the IVF aspect of it. Except you tell somebody now say, oh, I'll get this pregnancy through IVF. But the whole process is not still the same with normal pregnancy. In
terms of removing the eggs, how many eggs will they pull per cycle?
It depends on how much the woman produce. Okay. Which is a challenge for we in a salon. So far, we need to forget a lot of eggs. We start for looking to the reason why. But it all depends. We need to determine how many eggs we produce. So when we put you on the medications there for monitor the follicles, now part of that we look at. We look at say any follicle way bigger than 18 millimeters. We look at and say it's a possibility that this follicle will get an egg in there before we even trigger you. So the much bigger ones that we're able for harvest, the greater chance it is that we get eggs. Even though the amount of follicle not really the equivalent to the amount of eggs we get. Because when we harvest them out, the embryologists now they take this fluid, look at them under the microscope and really pick. So we might get a lot of eggs, but they are not so good eggs either.
So how best the clinic they try for get Sierra Leoneans we go be professional with regards to treating IVF, rather than we get people from another country for coming give help. So our best not only get people who now for send out or who study more on this particular area.
Well, so far we don't get anybody for say we go send out, but I'm happy that I think it was like 2 years ago where even College of Medicine now get a GYN I think discipline now. So then one day when they come in, the young doctors then, or anybody who interested as an OB doctor who interested in getting IVF training, I think it's a good thing for them for coming into that. And also we probably get other students away want to do embryology. That's an area to explore.
Okay. This is our first successful case in the country, and I'm pretty sure the clinic go on for they check on this particular picking. We don't go through the IVF, so I don't know how best when I get for they do a follow up or check on the cumbria on how best the picking they go up.
So we constantly they in touch with I would say almost all we patients. Apart from even this one we don't succeed, the one that we're not can succeed, we still follow up with them for make sure say then they do well and then they hope for can do the procedure back. So yes, we constantly they in touch with patients.
So for the benefits of the one that we don't watch and tell somebody they were interested, they want to go through this particular method, how they go get to now? So
they can call 078 667056. So 078 6670.
Number. We get candidates.
Very interested.
So what's the clinic there?
We then at John Obey, and we also get a sister clinic na Joe by Kosoton area.
That's so far, Jonobe.
Well, we look for a side
of the
yes, and then yes, because of the kind of work they do, and also when you think about something where they happen inside a human body, we want to do outside, we need limited pollution. Right. So now the only side I know we think so we go for do at this point.
Any plan there for take the clinic on other parts in the country if people they were not able to come na Tonga?
Eventually, yes, but for now, we still work through a lot of other things then first. Look and say if people in the left here for go overseas for go do I not think stage will not be that far.
Alright, so well, let me look at message them where the viewers and don't send this morning and ask questions them related to the topic we look at this morning when our health, and we focus now on IVF as the Sarah Hope Fertility Clinic don't get them first successful case of somebody will go through the IVF method and it don't deliver in pick. I know we not be asked now boy pick your girl picking.
Girl picking.
Alright, okay. And the person deliver a beautiful girl picking when at the first time this is Sierra Leone somebody don't go through this method. Not to travel, it then I go through and it be successful, it don't get in baby. We dey wish the Kumga all the best, and now we dey look at message them where people they don't send so far at the program. The very first one I look at from the Facebook page. Mystic Nadwazak say, good to hear from an expert. Honestly, such awareness needs to be cascaded in the community through outreach engagements so that the public can get the awareness, especially for women.
I'll take this one again from a Facebook page. It come out from Sarah Wula Tarali. He said this is a groundbreaking record for Sierra Leone. There is now hope for every woman. Congratulations, CEO and team.
For the Mustafa Turen at the Facebook page, it say, good morning, very important program this morning. My advice is that this IVF process is propagated to every part of the country. There are people who always wanted to do such procedure, but had to fly abroad, and this is very difficult for many.
All right, I'll quickly take this one. It come up from Eddie Grant. He said, I would like to know the full cost of the IVF treatment too.
Alusain Sise say Liberty TV, Sierra Leone is blessed with such facility in terms of infertility issues. Congratulations to Sarah Hope Fertility. All right, the facility and the facility. Okay, so I'll go over Alusain Sise in message again. It says Liberty TV, Sierra Leone is blessed with such facility in terms of infertility issues. Congratulations to Sarah Hope Fertility, and we hope this message will go far. Thanks to Justina Jallo Jamboria for just a brilliant move. Sierra Leoneans, we are struggling to have such facility.
RJ Advin Kuruma, on our Facebook page, they say this is great, especially for those women that are faced with suicidal bullying, all in the name of giving birth to their own child.
Eddie again, they ask, say, one for know the cost we involved for froze a female egg.
All right, from we Facebook page, I'll take the last one. We come up from Suleiman Kamara. I say, good morning, Liberty TV, and my man in the studio, Al Hassan Kuma. It's a pleasure to watch this particular show.
All right, well, from that message, and they will come over to his studio guest. Before they respond to the specific one, they especially Eddie, where they ask for the cost we involve and all of that. You will notice that even from the message them, people in perception, but this whole IVF gets to do with woman them. Sometimes they may miss the beginning where you've been talking not to woman them no more, but now also the help man them. Take me through that.
So infertility, I would say, now both man and woman issue. I know say now we culture anytime a woman not born, now they say now the woman get problem.
Yeah.
But not to the woman mostly get problem. Me, I can always say this. If when they try for reach at a goal, meaning when the goal will be for born picking, then picking or then all two problem, not to the woman no more. You know. So in that case, I go say the first thing I go tell every couple, if when I don't try for born picking and when I do one for born picking, una go get tested, una all two. You the man and the woman una go and get the test done. And make una see outside the challenge they come out.
At the grant they ask say what thing it go cost for the woman go through for keeping egg.
For keeping egg. So the cost for keep the egg, I believe it's about, so it not include the freezing of the egg, not include the process itself of stimulation and harvesting. It not include that. Just follow we keep your egg for you after we don't retrieve. I think it's about 2,000. But right. Eddie can call, can text me on WhatsApp on that number where I give, and we billing team cable for getting the cost, actual cost.
Why somebody for choose IVF if you don't go through this struggle for long? Why for choose them?
So why a couple go choose IVF? I would say if the goal, of course, not for born picking, and you don't try every other means, IVF pretty much can be the last resort. If the challenge can be, say, you woman, you tubes block, then there is no way the sperm go for swim and meet your egg. So definitely, na IVF na the option. Then if you get a woman also where they get multiple miscarriages, then I will say IVF na the option with the side of say use a surrogate, you know, or even with you trying for carrier can be say yes, do IVF and we support you with a lot of medication and hormones for let you for carry this begin to full time. If you're a woman with the struggle with PCOS, polycystic ovarian syndrome, I will say yes, IVF now option for you. For let you do them. If you're not older person, I will say IVF, meaning you are over 40, I will say yes, IVF an option for you. And if you're not a woman also we get maybe early ovarian failure, meaning even though you're young but you know they produce egg, which a test can show, I will say yes, IVF now for you. Or you get your husband where need to produce sperm at all, or if they produce sperm but in sperm one the count low and the sperm they're not strong enough and you get a lot of defected sperm, I will say yes, IVF now for you.
So in terms of the challenges that we been highlight earlier for sustain this particular clinic or perhaps get them all over the country, what's in it for be done? Because if we not sustain them as a nation, then people will still need for to spend a lot of money for going out of country them for go through the procedure.
Well, I would say we still need government support, you know. We start with the, of course, light not there. So now we get for put on generator. It's yes, it is a private clinic, but I think it's a good thing for we all as a nation. So no matter what, there are still things where government can come in and see how best they can able for subsidizing stuff than they for we. Bringing in with drugs, they cost we a lot for import them. The taxes what we pay for bringing them come in. Even bringing in the nitrogen liquid, it still cost we a lot, you know. So there are little things where I think say where government can come in and help we for able to keep this thing going on as alone.
And I don't like make the Ministry of Health know say a facility like this exists and on already don't get to a false successful case.
Well, since the pikin just born on Monday, we not meet the ministry yet for say yes, we don't get a false case, but they are aware say we deny. Yes.
Now only then cases here the clinic they deal with the IVF or there are other things they want to treat as well.
We they treat other things as well. As I say, we also do surgeries, and then even within the infertility aspect itself, not to everybody up front we advise say do IVF. So Monday we don't do the test for the woman, do the test for the man get good sperm, we can try something as simple as time intercourse, meaning we put the woman on medicine, we tell her now to when for sleep, and that don't also give a result. You know, then we also get a part of what we can say what they call IUI, winner intrauterine insemination. It's almost similar to IVF. The difference is that with this one, when they remove the egg from the woman. So we put the woman on medications also for like produce plenty egg. We get a man in sperm if the sperm very, very good. And then we introduce her into the woman and then it can find a way now swim and meet the egg and then pregnancy can take place.
Earlier on you talk about this tramadol, where I get a lot of concern with regards to that say that really affects young man them, you know, with regards to giving birth, you know, to picking them. So how serious it is for young people who they take tramadol and go on for born picking?
Well, not only tramadol. They say any illegal drugs, they cause effect in infertility. Anything where they alter the sensories, anything where they alter your hormones, they cause effect. Just as we talk about alcohol. Alcohol also they're a big concern when it comes to sperm production. Smoking is a big concern when it comes to sperm production. And the other great issue where they see also is infection. Okay. You know, you go get a young man, maybe you don't get infection and always get a right treatment, but because the symptoms they bother anymore, you know, decide for go for any more clear treatment. Then you can go years and years and years now, you don't become a big man, you don't marry, but picking they come. Because that infection will happen when you be younger, you know, take good care of them, you know, not completely treat them off any clear.
In terms of acceptance between the man and the woman, where then they go to the facility, would that easy for accept? Yes, this is a medical condition and we can work on it.
So I would say similar, I would say equal in terms of percentage wise. The challenge we face now when you get for tell a man for say there is no hope for we for using sperm or use donor sperm. We still face a great challenge in that. But as I say, for some people, there is no option other than that. Because you not produce sperm, not get for change. Especially if you get for do with your chromosomes, if you get for do with all the way down to your DNA factor, you not get for change. You know.
from what you dey see and from them testimonies and day, it possible for let a couple go on a tell them then they agree say let them get a donor and that marriage they continue?
Well, I mean, actually get a couple where the man say, the man in concern was that another problem for use a donor sperm. But I don't want this woman for look at me tomorrow and tell me, say, not to me picking this. So, all that they can come in terms of counseling. But I also think, say, if you don't marry this woman for a long time, you gonna know the kind of woman we married, or you gonna know the kind of man we married. You know, Mickey always say, the peace not the home, not to the picking for bringing the peace for the day before the picking they come. So if we also don't work on this marriage, the picking for be an additional blessing to the marriage. You know, so we're not also able to navigate through the system. It's either that or then even without the picking, the marriage can still scatter. You know, so now also for work together as a team, forget what we now want when are picking. And if the solution is for change, then
because the reason why I ask, we can hear it from story them where some man if you don't go one clinic, for example, to una tell and say this select what you do in order for work pass we get a donor, it go still go try to other woman. So until just because me and this woman it just not possible for let we meet. It possible that man they go try to other woman work.
If you know the police spam, you know the police spam. So that they not get for change. You know. Okay. I think say there are a lot of things where DNA don't prove, where a lot of and then now they opt for immediately, where picking born still and check. You know, and a few of the issues then they. I think say if from the get-go the man don't really check and see where I stand. It go no say this finally last them and try for do this than for say I go try with another woman possible say go get belly.
We can see some couple before then they married, they can let them go do medical, let them see the to not get the same blood type or thing we go make the to not able for born picking. Is it a myth or a thing we natural say it possible let two people are married but they're not able for meet and get picking?
So it's not a thing like myth. Why make they say so? Most of the testing that they can do, it's more catered through for see if they then get sickle cell. They need to actually check the fertility aspect of it. They need to check the hormonal levels of the woman or the sperm of the man. Then just look at them from that point of say there is no infection, and then these people they don't not get none of them not to sickle cell carrier or they even get sickle cell. Okay. You know, so the real testing when it comes to fertility part, they need to actually look into them.
All right, well, as we wrap up this edition of the Breakfast Show, before you left, we're waiting at your message to on our potential patients them way perhaps they watch you this morning.
So, family, I will say thank you for listening to we. If you struggle with infertility, if you don't be 1 year, you're a husband, they try to get picking. I will say when I stop by at Sierra Hope, Lord, we do testing and Lord, we see what we can able for do and how for help on for achieve that on a goal for say when I get to picking.
All right. Well, many thanks to you, Madam Justina Jallo Jamboria, the CEO for Sierra Hope Fertility Clinic, for waking at the studio this morning for cancer but all waiting people need for no but IVF when on a clinic don't get the first successful case, somebody don't go through them and give birth to a baby girl. We wish you all the best and we hope say people where they watch in case you get any concern or comments or how na go reach them, go through the video na the Liberty Online Television different platform them. You will get the information if you don't share the contact number and also na go find the clinic. Until we meet again, many thanks to na all we don't send on a message to the production team and everybody who made this particular edition of the program meet you. Mina Mebel Kabade say get a wonderful day and goodbye.
And Mina Al Hassan Kuma, stay blessed, have a comfortable day.
Thank you.
Thank you.